Hello. So today I'll be talking about heart attack or myocardial infarction versus cardiac arrest. What is heart attack? Heart attack simply means when there is a reduced blood supply to the heart. What can cause it? It can be caused by a plaque, which is a buildup of fat deposits in a condition called arteriosclerosis. There's a plaque in the arteries, and when there's this fat deposit, it could harden the arteries. And you know that the arteries are blood vessels where blood passes through, and so this could prevent blood supply to the heart muscles, and you could see that the heart muscles begin to die off. And so when there's a narrowing or the hardening of the arteries, you could see that the blood will not supply well, will not flow well, and there could be a clumping of the blood. And that could be like bring about clots. The arteries may rupture. So this will lead to reduced blood supply to the heart, and the heart muscles, heart will not be pumping out blood enough anymore. So what are the risks, or what are the signs and symptoms you can see when someone is having a heart attack? The signs and symptoms are you see the person having crushing chest pain. It could be heavy, it could be light, on depends on individual. The crushing chest pain could radiate to the jaw, could radiate to the arms, to the shoulders, or even to the back. Also, the person can start having shortness of breath, feel like the person cannot breathe, and that could make the person feel more anxious, like he's having an impending doom or impending danger coming upon him. Person is anxious, quite anxious. People could be having palpitations. When you check the heartbeat is like boom, 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 boom. And then a person is mostly in women, they could have nausea, vomiting, like indigestion symptoms. They will feel like if someone that used to have peptic ulcer or indigestion problem, person will start thinking, oh, is it my ulcer problem or that? But just link it with other signs or symptoms that I've mentioned. If that person is having that nausea or that chest pain, you know that no, this is not just an ordinary peptic ulcer problem. It's not like the indigestion or acid reflux that causes that chest pain or um, chest pain in people that have peptic ulcer. So you know that this one is different. Just to be observant of the difference between when you're having a myocardial infarction and you're having just your ulcer signs or gastritic signs. So we've talked about the signs and symptoms now. We want to talk about the risk factors. I also talk about causes because one of the causes is more of the arteriosclerosis when there is a plaque, a fat deposit build up in the arteries, and also there's a clot because that could bring about a blood clot, and that clot is preventing the blood to flow to the heart. The risk factors could be age. When one start growing older, you start noticing those symptoms start coming in because with old age, you see that the arteries are not functioning properly as it used to be. Blood becomes sluggish in flowing, especially when one has unhealthy lifestyle. Another risk factors is family history. When one has a family member that has had a heart condition, could be a previous myocardial infarction or another heart condition, coronary artery disease or thereabouts, one is the chances that one could have a heart attack. I mentioned lifestyle. What about the lifestyle? We want to have a sedentary lifestyle, lack of exercises. Person who is working from home or is working from the office, always sitting down, and they come back, no exercise. No, it could relate to that. Also, smoking. What does smoking does? Smoking does what is called vasoconstriction. It constricts the blood vessels and there will not be proper blood flow through the vessels. So smoking, alcohol, excessive alcohol intake as well can predispose to heart attack. And as I say, poor eating habits. When someone eats high fatty content, high saturated fatty content, you see the person when he goes for blood test, the fatty content, the cholesterol level, or the 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 low LDL, the low density lipoproteins are very high. So these are factors that can predispose one from having heart attack. And also certain conditions, certain disease conditions also can do that. Like when one is obese, when one has diabetes, when one has a case of stroke or high blood pressure. These are factors that can bring about risk factors for heart attack. Now, I want to talk about treatment generally. You've seen the signs and symptoms, how you note that someone is having a heart attack, because heart attack is a medical emergency. So when you see someone having these symptoms, you need to pick up your phone and ring, depending on the country you are, ring the emergency services. It could be 999, it could be 111. Depending on the country you are, you ring the emergency services. So what are the treatments? Depends if the person has had a previous heart attack. When one has had a previous heart attack, then probably they could have what is called nitroglycerin. It could be on the for the sublingual, it could be the tablet when you put under the tongue. You can use that spray depending on the dose that is being prescribed for you. You can use it in the first 5 minutes and after 5 minutes or after 15 minutes, depending on the prescription that is given to you. And that nitroglycerin relieves the chest pain. Also, it could be aspirin, because aspirin prevents the blood clots. But ensure that you follow your doctor's advice. This is not for any medical advice. Follow your doctor's advice. So they could give aspirin, they could give pain medications like morphine or whatever to relieve the pain, the chest pain as well. Person could be given oxygen as well, because the person usually have shortness of breath. So oxygen is there to be administered. So other medications now they can be prescribed for someone undergoing heart attack. But please follow your doctor's advice. But when you note these signs and symptoms, dial emergency services, because it's a medical emergency. So what are the complications that can result from one having a heart attack? The complications can be arrhythmias. Arrhythmia, which is abnormal heart rhythms. The heart is like an electrical system. It conducts impulses from one node to the other. Instead of that node going accordingly, from the SA node, I don't want to mention that. Instead of that node going accordingly, it goes the other way, haywire. That's arrhythmias. That's what complication of heart attack. You can also have heart failure. So yeah, when there's not enough blood supply to the heart, what do you expect? The heart will fail. You can also have heart valve attack. Heart valve attack could have cardiogenic shock. The person will be in shock. We could also have cardiac arrest. So one of the complications of heart attack is what? Cardiac arrest. Now, what is cardiac arrest? Cardiac arrest simply means when one suddenly collapses, loses consciousness, or when one is not breathing. Or it might be breathing, but it's not breathing normally. When you check the breathing, when you listen to feel, look, you might not, the person is not breathing properly. There might not be, did you see the chest rising, it would not be there. So this is cardiac arrest, and it is a medical emergency. Person might collapse on the floor. Suddenly, you might be with somebody. You might have a celebrity or a friend or member that you've noticed, that you've seen that or you've heard of. And person is alive, playing, and suddenly person collapses on the floor. Becomes unconscious and is not breathing, or is not breathing normally. What do you do? First of all, you need to ring for medical emergencies. It's a medical emergency, so you need to ring for emergency services. You could ring 999, or depending on the country you are in. But you need to start CPR, cardiopulmonary resuscitation. But before you do that, also it depends on the country you are. You should know if that person has an alert that says do not resuscitate. If the person is having that do not resuscitate, don't touch the person. But generally, for other people, you need to resuscitate. That's where the CPR is. Start your cardiac compression. So, but for you to do that, you need to be trained. You do your 30 compressions to 2 breathing, to 2 respiration, or 2 breaths, 2 breaths. So you need to be properly trained. And one thing is that you must not be a health professional. You must not be a doctor. You must not be a nurse. You must not be a lab scientist or whatever to be CPR certified, to be certified in CPR or basic life support. You could just go for training for that. Because studies have proven that when CPR is initiated immediately, there's high chances of the person surviving. As you're doing that, doing the CPR, I'm giving the respiration of the breaths. Also, you're waiting for the emergency services who will come and help us bring out their resuscitative equipment, defibrillator to apply shock to the person. But at least you've done something to save that person. Thank you. Oh my God.